I'm Dr. Daniel Katz, a psychologist, and I was just interviewed on ABC News Live about Looksmaxxing. And here's what I couldn't say on live television. Wanting to look better is normal, but there's a point where self-improvement can gradually start controlling your time, your behavior, your relationships, and eventually how you feel about yourself. I recently appeared on ABC News Live to talk about Looksmaxxing, and it was a really interesting conversation. But television segments can move pretty quickly. I only had a few minutes to explain something that is psychologically pretty complicated. So I wanted to take a little more time today and talk about what I couldn't fully explain on TV. I'm Dr. Daniel Katz, a psychologist and a therapist, and this is Psych Talk, where I make psychology make sense. So first, what exactly is Looksmaxxing? Looksmaxxing is a term that's grown popular among young men recently. It really just means to maximize your physical attractiveness. And this exists on a continuum. At one end of the continuum, there's things like exercising, taking care of your skin, dressing better, getting a haircut that makes you feel more confident, things like that. And those all can be healthy forms of self-care. But in some online communities, Looksmaxxing can become much more extreme. People start engaging in dangerous dieting. They might misuse steroids or other black market supplements, repeatedly pursue cosmetic procedures, or just try risky or unproven methods to change their appearance. And there's a message there, and that message gradually becomes that every feature on your body is a problem that needs to be optimized. Eventually, someone might start to believe that their happiness, their relationships, their success, and their self-worth completely depend upon fixing every imperceived perfection. And this is when self-improvement can turn towards self-destruction. So why is this becoming so popular? I don't think there's one simple explanation to that. Social media has certainly made our appearance more visible, more measurable, more comparable than it has ever been. People are constantly exposed to ranking systems, ratings, before and after pictures, photoshopped bodies, facial proportions, and advice on how to be more attractive. And the internet has just increased access of all of that information. But something I tell my clients a lot, we usually aren't comparing ourselves to the average person. We're comparing ourselves to carefully curated images that usually involve things like filters, lighting, photoshopping, editing, cosmetic procedures, and all kinds of things just to get one great photo. There are entire online communities that have been built around analyzing people's appearances. Someone can upload a photograph and receive a detailed list of everything that strangers believe that they should change. And for a vulnerable person, that can create a very powerful cycle. You start to become insecure about a feature, so you search for information about it. The algorithm shows you more content about that one feature, and you start comparing yourself more and more often. And then you start to become convinced that that feature is a serious problem. Social media, of course, does not cause every person who uses it to develop a mental health condition. Most people who watch Looksmaxxing content or searched out online will not develop body dysmorphic disorder. But for someone who is already very vulnerable to anxiety, obsessive thinking, perfectionism, low self-worth, this kind of content might just intensify comparison and self-criticism. So what is body dysmorphic disorder? And where is the line between self-improvement and body dysmorphic disorder? Body dysmorphic disorder, or BDD, is a mental health condition that involves an intense preoccupation with perceived flaws in someone's appearance. These flaws often appear very minor or not even visible at all to other people. Remember, caring about your appearance is common. To understand when it becomes clinically significant, focus on function. What are these concerns doing to a person's life? Are the thoughts intrusive and difficult to control? Does the person feel driven to check, compare, hide, seek reassurance, or repeatedly try to fix the perceived problem? Are these concerns interfering with school, with work, with relationships, with health, or with just the person's willingness to participate in everyday life? In clinical practice, I try to pay attention to 4 major warning signs. First, preoccupation. How much time is it taking? Someone might spend hours thinking about their jaw, their skin, their hair, their weight, their nose, their height, or another part of their appearance. They may look at photographs repeatedly, examine themselves from different angles, or constantly research ways to change that one feature. Sometimes even when they're doing something else, their attention stays focused on that one thing. Red flag number 2, compulsion. Does the person feel driven to perform behaviors that they have difficulty stopping? This often includes things like checking yourself in the mirror or avoiding mirrors, comparing themselves to other people, taking dozens of photographs, excessively grooming or rubbing certain parts of their body, sometimes seeking reassurance or repeated cosmetic procedures. These behaviors usually briefly reduce anxiety, but that also teaches the brain that checking and reassurance is necessary and is the only way to reduce that anxiety. So the next time the person feels insecure, they become more likely to repeat that behavior. Red flag number 3, impairment. How much is this concern about their appearance changing how someone lives? Oftentimes, people might avoid things like dating or swimming with a shirt off, or photographs, bright lighting, social events, sometimes even leaving home or going to work or school. They might stop seeing friends because they don't want anyone to look at them. Some people can really postpone important parts of their lives until they believe they've finally fixed their appearance. When it starts really interfering with someone's daily life, that's when it's a problem, especially if they stop doing things that they used to enjoy. Red flag number 4, escalation. Are their attempts to change their appearance becoming increasingly extreme, risky, or expensive? Someone might move from ordinary exercising into more rigid dieting and compulsive exercising. They may have started taking creatine or over-the-counter supplements and start using steroids, hormones, or other things they have to buy on the black market. Maybe they spend money they can't afford to pursue repeated cosmetic procedures, the whole time while remaining convinced that the previous procedure didn't adequately fix the problem. Now, a person does not need to show every one of these 4 signs to deserve support, but when their appearance concerns are consuming substantial time, creating compulsive behavior, limiting someone's life, or leading to dangerous decisions, a professional evaluation is probably appropriate. Why don't cosmetic procedures always solve the problem? Listen, cosmetic procedures are not automatically unhealthy, and cosmetic procedures are not automatically unhealthy, and choosing to have a cosmetic procedure does not mean someone has BDD. The concern becomes when body dysmorphic disorder is driving the decision. You see, it often operates through a repeating cycle. A person notices a perceived flaw and experiences anxiety and shame or just disgust. So they try to reduce those feelings by checking, by comparing, by seeking reassurance, or by getting treatment. And that might temporarily bring relief. But the underlying pattern remains. The problem is much more mental than it is physical. So after the procedure, the person may become intensely focused on the result. They may believe that something went wrong, or they might notice a new imperfection, or shift their attention to just another part of the body completely. The physical feature may have changed, but the obsessive cycle continues. This is why BDD is treated as a mental health condition, rather than just a cosmetic condition. What should parents, partners, and friends watch for? Pay attention to the changes in someone's personal life. Are appearance concerns taking up a lot more of their conversations and mental energy? Are they withdrawing from friends, or dating, or school, or swimming, photographs, just activities that they used to enjoy? Are they eating, exercising, using supplements, or spending more in a more rigid or extreme way than before? It can also be helpful to notice when someone repeatedly asks you to evaluate their appearance, and when they frequently seek reassurance from you that their appearance is okay. Reassuring them might feel supportive, but endless reassurance can sometimes just become another part of the problem. You don't have to debate whether the flaw is real or not, or try to convince them that they're attractive. Here's something you could say. I can see how much distress this is causing you. I'm concerned about how much time it's taking and what it's keeping you from doing. I think it would be worthwhile to talk with someone who really understands body image and these concerns. That keeps the focus on their distress and functioning rather than turning it into a conversation or an argument about their appearance. Can body dysmorphic disorder be treated? Yes. Specialized cognitive behavioral therapy has really strong evidence for treating body dysmorphic disorder. Recent meta-analysis has put the numbers into 68% to 72% of patients respond to CBT for BDD. Treatment might include helping someone understand their obsessive cycles, to gradually face the situations they've been avoiding, and to reduce those behaviors such as checking, comparing, reassurance seeking, and hiding. Slowly, the person learns that the appearance-related anxiety can arise and eventually come down without performing those rituals. Treatment is not about trying to win an argument to make someone feel attractive. The work focuses on changing the person's relationship with appearance-related thoughts, so that those thoughts no longer dictate how they live. And again, the research is encouraging. Studies have found 68 to 72% of people respond to treatment. This, of course, does not mean that everyone recovers immediately or never struggles again. Symptoms can flare during periods of stress, but many people can learn to recognize the cycle and respond differently to their obsessive thoughts. Wanting to look better is not a mental disorder. The warning sign appears when appearance stops being one part of your life and starts deciding whether you leave the house, see friends, date, go swimming, or otherwise just feel worthy as a person. Looksmaxxing might begin usually as self-improvement, but for some people, it becomes an endless project with no finish line. If appearance concerns are controlling your life, you deserve more than another optimization strategy. You deserve support from someone who understands what is actually happening to keep the cycle going. If you found this useful, please subscribe to Psych Talk for more practical, evidence-based psychology and mental health content.